Recent advances in technology means that a critical mass of HIV-related health data with actionable intelligence is available for optimizing health outcomes, improving and informing surveillance. Hello and welcome to another episode of The Last Mile with NACA. I am Adesu Sui. This episode highlights the benefits inherent in leveraging the digital age and how data science is being used to reimagine HIV treatment and prevention in Nigeria. Don't go away.
To support HIV and AIDS research, as well as monitor and evaluate all HIV and AIDS activities in the country, are two, among other mandates, vested on the National Agency for the Control of AIDS, NACA, as the body charged with leading the multi-sectoral response to HIV. NACA and partners, especially from 2015, intensified research and data gathering, which was instrumental in Nigeria's achievement of exceeding the UN AIDS 90-90-90 targets.
It is expected that when you reach 95% of all the people that live with HIV in a country have been identified. And 95% of all those who have been identified have been successfully placed on treatment. And 95% of all those who have been successfully placed on treatment are doing well on treatment. That is, the treatment is suppressing the virus. You don't see the virus, and when you don't see it, you don't transmit it. So the level of new infection you see in that country will drastically drop to less than maybe 10%, because you have succeeded in keeping the virus within people that have it. And that is the goal. So once that is achieved, it is considered that a country that has achieved that has reached epidemic control. The virus is under control. The virus is not spreading. Even if it is spreading at a rate that is negligible, and at a rate that routine program that we have on ground consistently, will continue to identify those remnants and place them on treatment.
Data science plays a key but complementary role in supporting current efforts in prevention, diagnosis, treatment and response needed to end the HIV epidemic.
Data are key. You need data to plan, you need data to monitor, you need data to know when you're achieving your goals, and you need data to know when you have conquered. And if we don't have the information, we will not know how many people are supposed to be our target. We will not know the number of people or estimated number of people living with HIV/AIDS in Nigeria. And if we don't know that, then when do we know that we have identified virtually everyone that is living with the virus and we have placed them on treatment, and now we are sure that the virus is fixed, it's not moving among people? We can only know that, when we track, monitor, evaluate, and you all do that with data. If you don't have data, you can't do.
The Research, Monitoring and Evaluation Department of NACA is tasked with data management.
Our department is very pivotal to the monitoring and evaluation of HIV/AIDS response. First of all, we develop the very important task we do is development of, we call it the HIV/AIDS monitoring plan. This plan monitors the national strategic plan. So we are I call it the monitors, the eye of what is happening, and also present the response in the place and showcase the response and also the achievement of the response. We're also involved in research activities. We also do operational research of so many projects, and we do evaluation. We also monitor the day-to-day activities of the response. So we present this data and result to the public, to partners, to funders of the response, and to the general public.
Our mandate is to coordinate all HIV/AIDS related researches in the country, take active part in the research, in HIV/AIDS related research activities, and coordinate all of these activities in the country. Research is very important to epidemic, especially now that we are looking at epidemic control and sustainability. Research helps us generate information that impart on programs to better deliver programs to the people affected with HIV/AIDS, which is the reason we have NACA.
The importance of a unified data system from all parties in the response gave birth to the National Data Repository, NDR.
The data repository gave us information of what is happening in virtually all facilities that we have services across the country. It helps us to monitor, it helps us evaluate, and it helps us also in terms of looking at long-term surveillance. How do we see, where issues are coming up?
And this data we have is real time. As the data is coming in, we are collecting them and we are storing them and we are analyzing the data. So at every point in time, you can actually get the real time, the up-to-date data of those who are on treatment, those who are virally suppressed, those who have received testing and know their status. We can actually get that data. Also, the National Data Repository will tell you not just the aggregate data. Aggregate means the sum data for the country. It also tell you the distribution of these achievements in states where we are performing very poor, in states where they are performing well. So then you look at the National Data Repository, it will tell you the partners are even performing well. Even the local facility that data is coming from, the state where the new infection is coming from, the locality, that area, that granular level, the facility where, that area where the issues are coming from, our NDR will tell us. That's the beauty of it to program.
The Research, Monitoring and Evaluation Department also developed the concept for the Nigeria HIV and AIDS Indicator and Impact Survey, NAIS, conducted in 2018.
The NAIS was adjourned the largest survey in the world, and before now, other surveys were telling us of the prevalence and the distribution of HIV is a burden, but it was not very accurate. For example, before NAIS data, we have 700,000 people on treatment. We never knew that at that level we still achieved, but we actually reduced, we played down our achievement level because of the incorrect data. So NAIS has come to actually rebase the epidemic, we call it rebase the epidemics, to actually give us the correct data. Now we now know that the number of people with HIV is not 3.4, it's about 1.2, 1.9. And that's why we can boast to say that we're in the last mile. After putting about 1.7 to 1.8 people on treatment, we're in the last mile. We are reaching the goal.
NACA also conducted other studies following the findings from the NAIS, which showed high HIV prevalence among key populations.
Integrated behavioral and biological surveillance data study, where we now focus on these three KPs, called the key population: men who have sex with men, and female and male sex workers. You have people with J drugs, and also of recent added transgender. Those who are at high risk of getting the infection. So we now concentrate on them, these four main groups. And because if you don't do so, you can't achieve epidemic control because they are part of the society. And again, before then, we did what we call key population size estimate. We want to know the burden of this. We did that in 17 states. There's plan to do that in many 20 states. So by that, we now have a comprehensive picture of HIV epidemic in the country. So in the general population, the key population, and we also forget, we also did that for prison. We did that for prison too. We now know that the prison, HIV in prison is very high, and again, it's about close to 10 times more than the average, more than the general population. So we now have beautiful data to showcase, to actually tell you where we are in the country and how the picture of HIV is epidemics in the country by these various studies conducted.
The Mode of Transmission Study is a recent program to analyze the distribution of new HIV infections in the country.
We have to control new infection to be able to achieve epidemic control. We have to reduce new infection as much as possible to be able to achieve epidemic control. So the mode of transmission studies has drawn our attentions to sources of new infection. And those sources are focused on the never married youths between ages of 17 to 34. The key populations like the men who have sex with men, female sex workers, and also mother-to-child transmission. These are the key areas or the prominent areas of new infection that we need to focus on if we are to achieve epidemic control. So the mode of transmission studies, I would say, is one of the very important new research activity we've just concluded.
The agency also carried out a survey that looks at stigma-related issues experienced by people living with HIV.
Stigma and discrimination is a major part, it's a major hindrance or barrier to PLHIV's accessing care. So sometimes even when you have the care available, you have provisions for services, they're afraid to come out for services, to access these services because they're afraid of stigma and discrimination. So we recently carried out a study. It's a global study which was coordinated by a global network of people living with HIV/AIDS. It was implemented or led by the network of people living with HIV/AIDS in Nigeria, working with stakeholders in a national response. But the objective of the study was to look at experiences, like I said, stigma and discrimination related experiences of people living with HIV/AIDS with regards to them accessing services that are available to them. You know, for example, you talk about pregnant women, that don't want to access services that are made available to them, which is why we have very low PMTCT coverage. So the study was to look at the modes of this stigma and discrimination. How does it present? Which factors promote it or influence it? Also, the study looked at the laws that are in place that help to protect the rights of people living with HIV/AIDS.
The agency is poised to do more, as tracking and compiling data are important elements in understanding and combating the spread of HIV and AIDS.
At the moment, the DG's priority is looking aggressively at epidemic control and not just achieving epidemic control, also sustaining the epidemic control. Because one thing to achieve is another thing to be able to sustain it. If you don't sustain it, then you're back to square one. So that's of primary importance to everybody in the agency at the moment. So we aggressively are looking at generating relevant and reliable data on timely manner to be able to make our input into achieving epidemic control and helping to sustain it.
We want to strengthen the National Data Repository. We want to also track data of those who are left out from age, among those adolescents and young people, from pregnant women, and also community activities that are ongoing. Also, the non-health sector data. Non-health sector, we want to actually strengthen we are doing well in non-health sector, in the health sector data that are from facilities. But there are some other HIV/AIDS activities that are not from facilities, that are in the communities. They are in schools. They are in different levels outside facility. They call it non-health sector, non-facility based. We want to strengthen data management so that we know what is happening in these various areas.
It's because we have data now. That's why we are telling the global community that we are reaching epidemic control. We're getting saturated, and our communities and our facilities where services are given, are taking up more people, identify more people living with HIV/AIDS and placing them on treatment. We are saying this because we have the information. If we don't have the information, we will not know. And if we don't have the information, we will not know how many people are supposed to be our target. We will not know the number of people or estimated number of people living with HIV/AIDS in Nigeria. And if we don't know that, then when do we know that we have identified virtually everyone? So that's how data is. So data is the life of your program. Without data, your program is dead.
Improved data will allow program managers to more accurately pinpoint where additional resources are needed to improve ART provision and clinical health outcomes.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
The update segment is next. Keep watching.
The National Agency for the Control of AIDS, NACA, recently celebrated the 15th anniversary as an agency. This day, dubbed the National HIV Response Stewardship Day, now celebrated annually since 2021, provides an opportunity to reflect on the journey thus far, share the vision to end the epidemic by 2030, and celebrate all communities, partners, and stakeholders for achieved milestones. The second edition of NACA Stewardship Day had in attendance many dignitaries, including the Secretary to the Government of the Federation, Minister of Health, Chargé d'Affaires, U.S. Embassy in Nigeria, representatives of sister agencies, implementing partners, and civil society organizations. Delivering the opening remarks, the Director General of NACA, Dr. Gambo Aliyu, expressed delight, stating that Nigeria is on the verge of achieving epidemic control.
I'm happy to say that after 2 decades of sustained fight against HIV and AIDS, Nigeria is on the verge of achieving unique programmatic indicators for epidemic control due to tremendous growth in our programs over the last 6 years. This year, we expect a tremendous growth in our program for prevention of mother-to-child transmission of HIV as we take key steps towards ensuring no child is born HIV positive in Nigeria. Our innovative strategies in program alignment by all stakeholders, service integration at all community levels, and strong political support at all levels made our national response the most COVID-19 resilient in the world, with the highest yield at the peak of COVID-19 pandemic. As we approach epidemic control, we need to end all forms of inequality, leave no one behind, as well as ensure inclusive implementation of our programs at community levels if we must sustain the gains made in the last 6 years.
The first set of goodwill messages were delivered by the Global Fund Portfolio Manager, Dr. Jean Thomas, and Mary Lorraine Melchizedek, representing the Controller General of the Nigerian Correctional Services.
The CGC wishes to thank NACA for their efforts towards the coordination of various organizations, international bodies, and agencies involved in the HIV/AIDS program in the Nigerian Correctional Service, ensuring that always we are not left behind in all areas of HIV/AIDS activities.
The Global Fund collaboration with Nigeria started even before NACA was born, 20 years ago. Since the beginning, the Global Fund has made Nigeria its major partners. So all this mobilization of resources is thanks to the good work that is done by NACA and also by all our partners here present. And I want to state here that the Global Fund will continue to play its role.
Citing effective partnership as critical in the HIV response, the Chargé d'Affaires, U.S. Embassy in Nigeria, Kathleen Fitzgibbon, pledged the U.S. government support to Nigeria.
With NACA, all of the SACAs, the state governors and health commissioners, NASCAP, UNAIDS, the Global Fund, ASHWAN, NEFWAN, our implementing partners, and now the HIV Trust Fund, and all of these allies in the fight against HIV. And as you can see, we're actually winning. And that's something that required partnership. Anybody couldn't have done this alone. So the theme of my discussion is kind of togetherness. So together we've hit the ground running and driving.
There were also goodwill messages from the NACA board chairman, Senator Oladipo Dujiri, and the Minister of Health, Dr. Osagie Ehanire. In his remarks, the Secretary to the Government of the Federation, Boss Mustafa, commended NACA and partners for the achievements so far and called on state governments to play more active roles in the national response.
Our achievements in the national HIV response underscore the fact that together we can achieve much more. I must emphasize the importance of partnerships, as well as the harmonization of programs for greater impact. It is in this regard that I call on state governments to take their rightful place in this national partnership as we develop a sustainability framework for the national response.
Nigeria has recorded several milestones in the last 15 years of NACA's existence, but more work needs to be done to ensure control of HIV and sustain all the achievements going forward.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o, during pregnancy or labour or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, dey live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsi. Goodbye.